Thing. Thing one. Jackie?
It's working, but the mechanism's getting stuck when you try to stop it. Yeah, but that's... This seems to work just there. I don't know why it's getting stuck.
Our witness before the medical panel will be Dr. John Ebersole. Mr. Ebersole, will you take the following oath, please? Do you swear that the testimony you are about to give is true to the best of your knowledge, information, and belief?
I do.
Please state your full name and address.
John Henry Ebersole, 1440 Hunsicker Road, Hunsicker, Lancaster, Pennsylvania.
What is your present employment?
I'm Chief of the Radiation Therapy Section of the Department of Radiology at Lancaster General Hospital, Lancaster, Pennsylvania.
Thank you. The primary questioner, the initial questioner, at least, for the medical panel will be Dr. Michael Bodden. Dr. Bodden?
Dr. Ebersole, we'd like to thank you for coming down. As we explained, the group here represents the medical review panel evaluating the medical aspects of the death of President Kennedy. Could you give any, and we appreciate your coming down to help us in evaluating these medical aspects. Could you give us any recollections that you have now of the condition of the President's body when you first saw it, and how you, your relationship to the dead body, what your function was, what your time there was?
On the day of the assassination, I was Acting Chief of Radiology at the Naval Hospital, Bethesda. The Chief of Radiology was away on official orders, and as Assistant Chief, I was, in fact, the Acting Chief. I was requested by the commanding officer about 4:30 in the afternoon to remain on board in or near the autopsy room to give any assistance that might be required in the way of x-rays. I was present in the autopsy room from the time the coffin arrived from Dallas with portable x-ray equipment and 2 x-ray technicians. With the exception of the periods when I personally carried the cassettes containing x-rays to the x-ray department, which was on the 4th floor of the hospital. With the exception of those periods, I was in the autopsy room from the time the coffin arrived to approximately 3 o'clock in the morning, at which time my services were obviously no longer necessary and I left the hospital. Upon removing the body from the coffin, anterior aspect, the only things noticeable were a small irregular ecchymotic area above the right supraorbital ridge and a neatly sutured transverse surgical wound across the lower neck. As we turned the body in the autopsy table, there was a textbook classical wound of entrance. Upper right back to the right of the midline, 3 or 4 centimeters to the right of the midline, just perhaps inside the medial border of the upper scapula. Again, I'd like to emphasize this was a textbook wound. Round, smooth, purplish, no raised margins. The back of the head was missing, an irregular, messy wound. At that point, we had a wound of entrance, i.e. the back wound, and no known wound of exit. So prior to starting the autopsy, we were asked to x-ray the body to determine the position, the presence of a bullet. We took several x-rays, skull, chest, trunk. These were taken in the autopsy room on the autopsy table. They were hand-carried by me in their cassettes to what we designate as Tower 4, the 4th floor of the hospital. Handled by a darkroom technician, given back to me and taken back, hand-carried by me to the autopsy room. The initial films showed the usual metallic fragments in the skull, but no evidence of a slug, a bullet. This was a little bit disconcerting. We were asked by the Secret Service agents present to repeat the films and did so. Once again, there was no evidence of a bullet. For those of you, I assume you're familiar with portable X-ray equipment. It's not the type of equipment that gives us fine diagnostic detail, but it is certainly very adequate in picking up any heavy metallic fragment. It will stand out like a sore thumb, either intact or shattered. The autopsy proceeded, and at this point I'm simply an observer. Dr. Humes, probing the wound of entrance, found it to extend perhaps over the apex of the right lung, bruising the pleura, and appeared to go toward or near the midline of the lower neck. I believe by 10 or 10:30, approximately, a communication had been established with Dallas, and it was learned that there had been a wound of exit in the lower neck that had been surgically repaired. I don't know if this was pre-mortem or post-mortem, but at that point the confusion, as far as we were concerned, stopped. The only function that I had was later in the evening, early in the morning, perhaps about 12:30, a large fragment of the occipital bone was received from Dallas, and at Dr. Fink's request, I x-rayed this. These were the last x-rays I took. The x-rays were taken by the Secret Service that evening. I did not see them again. And I must be a little bit vague on this point, but sometime within a month of the assassination, I received a call from the White House medical staff, a member of the White House medical staff, Captain James Young. Dr. Young asked me if I could review the skull x-rays for the purpose of getting some measurements for a sculptor. I said, yes, I thought that was feasible. I was driven to the White House annex where I did see the skull films and took certain measurements, and in taking those measurements may well have drawn lines on the film. It was then necessary for me to go back to Bethesda and determine some magnification or subtraction factors. Understand that in the use of portable X-ray equipment, the structures depicted are not necessarily related to actual size and life. Now, if one duplicates the conditions with a skull, you can establish a magnification factor or a subtraction factor. So after seeing the films of the White House Annex, I went back to Bethesda and using the same equipment and an anatomical skull, human skull, determined magnification factors. Actually, they were subtraction factors. The image in the film were larger than the image in life. We would expect from the physical setup. I then phoned to Dr. Young on an open telephone using an expression like something to the effect that Aunt Margaret's skirts needed the following change. Gave him the numbers to multiply the numbers I'd previously provided from examining the x-rays at the White House Annex. The third and last time that I saw these films was here in this building when they were placed in the archives with Dr. Humes present and Dr. Fink present. Also the photographer who took the picture. In summary, I'd like to emphasize one thing. These films, these x-rays, were taken solely for the purpose of finding what at that time was thought to be a bullet that had entered the body and not exited. If we were looking for fine bone detail, the type of diagnostic exquisite detail that you want in life, we would have taken the pictures in the X-ray department, made the films there. But we felt that the portable X-ray equipment was adequate for the purpose, i.e. locating the metallic fragment. In examining those films, such fine things were obvious as myelogram dye from a previous myelogram, with traces still present in the spinal canal. I did not testify at the Warren Commission. I have not testified or given witness to any official body except this one. I have been contacted by the usual sensation seekers and authors during the years, but have not made any comment, except on one occasion, when a fellow radiologist at the Rocky Mountain annual meeting, Radiological Society annual meeting in Denver, made the statement that a radiologist was not present at the time of the autopsy. This is Dr. Morgan from Johns Hopkins. In writing to Dr. Morgan, I stated that I certainly was present and gave him my qualifications. I did not receive an answer.
Thank you, Dr. Ebersole. A couple of questions relative to what you brought up. We have with us the X-rays in the archives, numbered 1 to 14. Do you remember, including the X-rays of the fragments that were brought up later, do you recall if those are the numbers of X-rays that you had placed in the archives?
Yes.
When you placed the X-rays in the archives, were you satisfied that they were each and every X-ray that you took? Is there any possibility there are additional X-rays that you did not see when you put the X-rays in the archives?
No, I feel those were the numbers we took on which there were images.
And did you take X-rays in which there weren't images? Or?
It may have been possible that at the most one film had no image on and was destroyed.
Okay, but there were no X-rays other than the ones that were put into the archives. Right. Do you recall when you took the X-rays in the sequence of taking X-rays, and you took the X-rays of initially before any incision was made in the body?
That's correct.
You took the head, chest, abdomen, extremities.
Right. The order was skull first, then chest, then trunk.
When Colonel Fink came in, these had already been taken.
Yes, and repeated once.
Now, when you say repeated, were X-rays repeated after the autopsy had started? Do you have an independent recollection of that? The second group of X-rays were taken either before the incision was made or very shortly thereafter. Maybe your memory will be refreshed as we go through the
right.
X-rays. Some comment had been made in the past about total body X-rays being taken, and the fact that the hands and feet aren't on these X-rays.
Right.
Did you take X-rays of the hands, feet?
No, we did not. We thought the films we took were adequate for the purpose for which they were taken.
When you first saw the body on the X-ray table, apart from yourself and Doctors Humes and Boswell, were there any other physicians who in any way participated or officially observed the autopsy?
No. At that time, to the best of my knowledge, only myself, Dr. Boswell, Dr. Humes were present. Dr. Fink was to arrive later.
Dr. Fink arrived later. Now, you mentioned that the tracheostomy was sutured when you first saw the body. The tracheostomy.
There was a sutured wound, a transverse wound at the base of the neck.
Do you remember any other sutured wounds?
No, I do not.
Sutured incisions that might have been...
No.
Do you know how Dr. Fink came to the autopsy room?
I believe Dr. Humes It's my personal belief Dr. Humes contacted him by telephone after things had started and asked him to meet it.
And do you know, or did you discuss, or do you have personal knowledge at the time of doing the examination whether there were any strictures as to the extent of the autopsy, or was the manner in which the autopsy done purely a decision made by the physicians there?
To the best of my knowledge, there were absolutely no restrictions, and it was Dr. Humes' decision as to the extent of the autopsy.
When the body arrived and was taken out of the casket, do you recall, was there a plastic bag around the head, or?
I don't recall. I was there when it was open. I don't recall a plastic bag, no.
Or did you have any impressions or concerns about possible soft tissue movements in taking the X-rays of the scalp tissues?
No. I personally held the head for the scope position and kept my hands in it.
Okay. I'm going to show you some of the X-rays and perhaps we can go over one by one, but does anybody have any comments, questions? Dr. Weston.
I'd like to go back to the conversation which you had with Captain James Young, in which you indicated that you went back to Bethesda, and when back there you had reason to correct your measurements. What was the basis for that correction?
X-ray beams are divergent from an X-ray tube.
Yes, I understand that, but
all X-ray beams from the tube diverge. An object placed here with a film underneath it is going to be distorted unless that object is placed at least 6 feet away from the tube. At that point, the divergence has become almost non-existent. This is why in X-raying the chest, measuring heart size, we want at least a distance of 6 feet so that we can measure the heart reasonably accurately. In the use of a portable X-ray equipment, the source of radiation is very close to the object. Therefore, there is a good deal of distortion secondary to divergence. Now, all one has to do is to duplicate that setup with a known steel ruler, what have you, of known distance. Repeat the performance, measure it on the new X-ray, and you have a factor. Perhaps your diameter from nasion to the occipital bone might have been 12 centimeters. As a result of the calibration of the setup, you might have to multiply this by something like 0.9 to have greater accuracy, or 0.8. It was that number that I had to go back and determine, and then phone to the White House to apply the numbers that I had furnished at the end.
Do you have any independent recollection, or do you have any record that would indicate what that factor was?
No, I do not.
You don't.
I remember that one of the key measurements that we wanted to make was from the nasion, the base of the nose, to the estimated point of the occipital. Now, the measurement I made was through the middle of the orbits, the AP.
And when you do this, do you take a mean distance of thickness? In other words, above the cassette, would you take, for example, the like in the middle of the head as an average, or
well, you try to find some anatomical landmarks that would be constant and that would be recognized by an artist.
Oh, I understand that, but I'm thinking about where you put your ruler when you determine the factor.
On the film. Or at some distance, right. Some mean distance from the film you can use.
In other words, do you recall what you did in that instance?
I used a skull.
Oh, you used a skull?
I used a skull. I said ruler here for this example, but I used a skull, a human skull, when I went back to Bethesda.
Uh-huh.
You know, an anatomic specimen that we had in the department.
And you set the portable. The portable moves up and down, doesn't it?
Yes.
How do you know that you set it at exactly the same distance?
We had a distance that we used at the night of the autopsy.
We used
that distance, we used that machine.
Yes.
and a human skull.
So you did make a record somewhere of how far above the body the...
Yes, that's the standard distance they use for portable X-ray machine. While it may be varied, it is kept as a standard for most work.
Incidentally, for the record, at that time that you did this, what was your position at Bethesda officially?
I was a commander, Michael Corps, United States Navy, Assistant Chief of Radiology, and head of the Radiation Therapy Nuclear Medicine Division.
When had you gone to medical? When had you gone to medical school?
University of Indiana Medical School, graduated in 1948.
And then you'd been in the military for how long?
I entered naval service July 1949.
And your position was as you described at the time of the shooting of President Kennedy?
From 1949 to 1959, I was associated with nuclear submarines and had special training in nuclear physics, Duke University in Oak Ridge, Tennessee. I commissioned and served on USS Nautilus and USS Seawolf, the first two nuclear submarines. When Seawolf was decommissioned in 1959, I started a residency in general radiology at Bethesda. I completed that residency in July 1963. At that time, I became chief of radiation therapy and nuclear medicine sections. In December 1963, I was board certified by the American Board of Radiology at the Cincinnati examination.
Now, one other point before we get to the X-rays, which are on the U-box. Some mention has been made to our committee about Dr. Yoon's asking who's in charge at the time of the autopsy, when he started the autopsy, to the persons in the autopsy room. Do you recall that specifically or anything like that? Comment that might have been made of that nature?
No, I don't recall, Dr. Button, any specific question. Dr. Humes might well have directed that to the many people who were milling around the autopsy room who were Secret Service agents, White House staff.
But there was no clear impression that you had that somebody in that room was in any way giving orders as to how the autopsy should be done.
To repeat some of these X-rays, when the first set showed no bullet.
In fact, we can identify these as we go along. Any other comments, questions?
Before it gets to actually reading the X-rays, I'd like to ask, this is not a reflection on your experience or anything. I'd just like to know for the record approximately how many gunshot cases you've had occasion to examine the X-rays of, and how many of them were in the velocity range of this kind of a missile and in these particular locations.
This has to be a rough estimate, Doctor. I suppose in the field of radiology, I have had to interpret X-rays during my residency, and subsequent to that, and perhaps 20 to 25 cases. Now, this ranges all the way from shotgun wounds to self-inflicted revolver wounds, so on. I couldn't say that any one of those 20 or 25 cases would be exactly the same as this one.
That's 20 to 25 cases altogether in any location.
Now,
all locations.
Pardon me? All locations.
All locations.
All locations.
Dr. Weston brought up a point about interpreting X-rays. That hopefully you'll be able to provide us two functions. One is discussions about technically what was happening when you're taking these X-rays, the fact that these are indeed the X-rays you've taken, as well as any insight you might give us as radiologists to the findings. Now, number one, you haven't seen these for a while. When was the last time you saw these?
Last time I saw these, and then it was not nice view box, but this was here in this building when we put them in the archives. What was that, 1966?
Perhaps we'll measuring device or radio opaque?
It's a metallic rectangular object, but I can't identify it now. It looks as if it could be used as a measuring device, yes.
Okay. Perhaps...
Dr. Biden, did you state the X-ray you were referring to?
X-rays 1 and 2. And it's also present on X-ray number 3. Now, number 1, do you recognize the 3 skull X-rays, 1, 2, and 3, as the ones you had taken?
When I last saw these, I personally fixed some metal tape to them. Was that on these at any time? Yeah, there we go.
The red metal tape, numbered 1, 2, and 3.
These are
You said a lot of...
these are the films.
These are films that you took?
Yeah.
And that you put into the archives later.
Right.
Now, in fact, on number 2, there are some lines, some penciled lines. Are these the lines you, I think the other side, that you refer to as having?
Yes. On number 2 specifically, this is a line that I made. Identify definitely the lower line running from the nasion, N-A-S-I-O-N, to the occipital area. There is a second line at an angle to that first one, which I also made. The attempt here was to get a line from the high point of the forehead back to the occiput.
And that was for purposes of, as you understood it, a sculptor's request?
As I understood, this was requested, this was information that might be of use to a sculptor in making a bust.
I'm looking on film number 1. You see there are 2 artifact points. Could you describe those and indicate what you think they do to?
These are raised, blistered, rounded areas on the X-ray film due to overheating the emulsion and probably coming about from placing it on or near what we call a hot light. Imagine a photoflood bulb and this place too close to it. Associated with these 2 areas, there are wrinkling in the film base, which also occurs when they are closely applied to a too hot a source.
Do you have any knowledge as to when and how they occurred?
No, I don't. They may well have occurred that night. I may have been the guilty party here as we were looking at these under bright light that night as well as under standard view boxes.
Do you, on examination of these films, have an opinion as to where the gunshot wound of entrance was in the head, radiologically?
My opinion would come from the side and the basis of the films. I guess all that can be said from the films at this time.
Had you had occasion in the past to review the films for purposes of determining...
No, sir. Again, I would like to emphasize my purpose of taking the films and my interpretation that night was solely to locate a bullet that at that time we thought was still in the body.
And your subsequent exposures to the film were in no way related to trying to identify, to interpret the films?
That's correct. They were to identify the films for insertion in the archives and on the interim occasion to get some measurements for the sculptor.
These 3 films in particular, were they all taken before the autopsy was begun?
Yes, the skull films were definitely taken.
Did you repeat the skull films?
To the best of my knowledge, no.
Michael, what are the numbers, please?
1, 2, and 3. 1, 2, and 3 of the skull film. Now, if anybody has any subsequent questions or comments, please do not hesitate to raise them. X-ray number, the one that labeled 4, 5, and 6 are the fragments. Now, is the number, who assigned the numbering to the film?
I think I probably did at the time it was put in the archive.
Let me put in the archive.
But temporally speaking, this was the last to be taken, number 4.
Or to rephrase the question, does the numbering in any way indicate the sequencing?
No, it does not. It does not the time sequence.
So 4, 5, and 6, which are X-rays of bone fragments, were the last films that you took? Now, the response to that was yes.
Yes.
Do you recall seeing those 3 fragments and X-raying the bones?
Yes. This was maybe midnight to 1 o'clock when these fragments arrived from Dallas.
After the autopsy?
The autopsy was still going on during that period.
And it's your impression that before the autopsy was finished, then at 10:30 at night, contact had been made between Dr. Humes and
I must say these times are approximate, but I would say in the range of 10 to 11 p.m., Dr. Humes had determined that a procedure had been carried out on the anterior neck, covering the wound of exit. Subsequent to that, the fragments arrived. At the time the fragments were X-rayed, Dr. Fink was present.
Do you have any idea, what did you do with the fragments after you finished X-raying them?
Returned to the autopsy room. They were kept in the autopsy room.
Do you have any independent recollection as to whether or not they were retained or interred with the body?
No recollection after giving them back to Dr. Humes.
Did you take them as portable?
No, sir, I believe that this one, closer to you,
I believe these were taken in the main X-ray department.
if you notice that the bone detail on these is really much better than the other film. And I think these I carried to the X-ray department and took them in the X-ray department.
All three X-rays?
All three.
4, 5, and 6.
Yes. And I'd particularly like to call your attention to 6 as being a finer quality film than you see in the other ones. That is more typical of the type of film that you obtain with stationary or regular diagnostic equipment rather than portable.
When you were taking these in the course of the X-rays, was there an attending physician, a radiologist about? Or
no, there was not.
And you consulted essentially with Dr. Humes and Dr.
Boswell.
Do you recall also when you took the X-rays of 4, 5, and 6, whether you turned the bones or were they all taken at 3 different exposures in the same position?
I can't recall that. I think the repeated films were necessary because we didn't feel that these early ones were properly exposed.
Was any attempt made that you recall to reconstruct the defect in the skull utilizing these 3 bones?
Not to my knowledge.
Do you recall discussion as to the significance of the radiopaque material in the one margin of the larger fragment?
I felt they were metallic fragments when they pulled.
Entrance or exit?
I don't believe I could tell.
Do you recall discussing that with the other doctors in the autopsy room? Now, do you recall discussing it specifically with Dr. Fink?
We discussed it, yes. I don't know if there's any conclusion reached.
was Dr. Fink at this point, or toward the after he came, actively involved?
Yes,
in,
particularly
in
looking at the fragments and looking at the X-rays.
Did he have gloves on, and was he actually dissecting? Or
No, he was not dissecting. As I remember, he was not down. And was not, during the time I was present, was not actively dissecting.
I take it that he was observing and talking
and in the background
to the processors.
Wait a minute. Did see the fragments, did handle the fragments, and then saw the X-ray.
On the largest fragment with the metal fragments present, the radiopaque fragment present, would you have any comment on that serrated margin on that fragment? And do you have any independent recollection of what the fragments look like, grossly, apart from the X-rays?
No, except that I was rather surprised on the X-rays to see the metallic fragments because I certainly could not see them by naked eye. The piece that I remember was the larger piece. It was handed to me in the commanding officer's office, and was wrapped in gauze, like ordinary fresh bone. They were then taken to the main X-ray department from the first floor and X-rayed there, then taken to the autopsy room.
Did you recall, were you told where they had, from whence they had been obtained?
Dr. Canada told me that those had just arrived from Dallas.
Where?
No, just arrived from Dallas, period.
Do you recall seeing beveling on the bones, on the largest fragment? No, you didn't see it, or no, you don't?
I did not. I don't recall the degree of beveling in that. This would have been something Dr. Fink would have been very interested in. I know from past experience with him, and they were turned over to him.
If in the course of our discussion you have any other recollections of anything that you think might be of value to the physicians here in evaluating all the medical findings, please don't hesitate to volunteer.
None at this point.
If anything comes to mind. Now, X-ray number 7, label number 7, is of the abdomen. Do you recall that X-ray?
Other than the marker, there's nothing to identify it as specific X-ray. Do you have one lower the pelvis to show me? I can do a little more sure identification here.
Yes, I will. X-ray number 14 is of the pelvis, and
although I don't see it now, in the course of taking these X-rays, there was some myelographic media present in the spinal canal, and this caused one of the Secret Service people to question if that might not be a... There we are.
Dr. Ebersole is now looking at X-ray number 13, which is also the pelvis, but has a view of is a more superior view.
At the time of the autopsy, I felt that this metallic fragment to the right of the midline represented myelographic media. I think what this really represents is a buckshot, since it's well to the right of the canal. This was the other possibility. It could either represent a buckshot in the appendix or a diverticulum or myelographic media. This I could very possibly identify as having taken that night. This was the rounded material. Myelographic media would be in and near the midline of the spinal canal, where this appears to be to the right. Could represent either thing, although I suspect from its density and its nice rounded appearance it's a buckshot.
What do you mean by buckshot, Dr. Ebersole?
Pellet from the bullet fired by the shell fired by a shotgun.
Would that are you implying that this would have been a pellet fired into the president at some previous time?
I'm implying that somewhere along the line he ate a duck or a rabbit or something shot with a shotgun, and that this is in either the appendix or diverticulum. I suspect if we went out to the street, we'd find something like 15 or 20% of the population to have that.
Excuse me, Dr. Barton, I'd like to interrupt at this time to switch the size of the tape. And also to document the tape momentarily stopped at 3:13 when the cord came out of the wall.
Yeah. Since I'm doesn't go after the autopsy had been done.
No, certainly the autopsy was not completed at the time of the second one. It would have possibly been started, but all X-rays, with the exception of fragments, were taken fairly early in the evening.
Do you recall independently whether the pelvic organs were looked at and examined in the course of the autopsy?
Yes, they were.
We've just completed reviewing X-rays 13 and 14. X-ray.
Could I have
Yes, please.
a clarification of that last question? Looked at and reviewed. What you add to that? Removed or not?
I didn't hear that.
Could you please repeat the question?
The question was clarification of the previous question of the abdominal organs were looked at and reviewed. My question was removed or not? To your knowledge.
To my knowledge, they were removed. I simply remember seeing the kidneys being weighed outside the body. Doctor, let me clarify this. Remember that at times I was outside the autopsy room for the purpose of getting these films, and then on one occasion called the commanding officer's office to pick up these fragments in from Dallas. So there could have been things that I would not be aware of, but I do specifically remember the kidney treatment.
Thank you. I think that's...
Could I ask a question before you go on with this? For the record, I'd like to feel. I'd like to have a little better handle on what you feel that you're qualified to testify about based on those X-ray films and your expertise. In other words, I don't want to pose questions to you.
Well, I think that your question is very different. I am not, although I was trained in diagnostic radiology, I am not a diagnostic radiologist and have not been since 1963, at which time I started doing radiation therapy and have been engaged in that full time since. As far as my expertise that night, I don't think it should be questioned, because what was being asked of my expertise was, is there a slug in the body?
I understand that. Yes. Well, I'm coming back to your expertise now. Now, looking at those skull films, you feel comfortable in saying there were fractures there. And yet I understood you to say that, I think, wouldn't you? And yet I understood you to say that you felt like there had been a bullet wound on the right side of the head. Is that correct?
No, I would say on the basis of those X-rays and X-rays only. One might say that one would have to estimate there that the wound of entrance was somewhere to the side or to the posterior quadrant.
Inside or the posterior?
This is 180 degrees.
Okay. Okay, fine. That's all right.
We did not...
May I interject one question and perhaps a comment? In your experience in reviewing X-ray films taken of the pelvic area and abdominal area of individuals, perhaps 15 or 20% of these individuals have shock in them.
Yes, sir. This depends a little bit on the part of the country, but it's certainly a very high instance of seeing a single buckshot in a pelvic X-ray.
May I also ask you what your definition of a buckshot is? I just want to get this.
This is the rounded metallic pellet of a shotgun shell.
Have you ever seen a bird or a rabbit shot with buckshot?
Yes.
I just want to bring out one thing. I believe it's birdshot.
Birdshot, you're correct. Let's say pellet.
Surely, I'm not trying to...
shotgun pellet.
I'm not trying to cast any aspersions on this. I merely want to get it right for the record.
You're
this
correct.
Is a birdshot.
Stand corrected. This is birdshot.
Birdshot. And first the book. I take it also from your initial responses to, pursuant to Dr. Weston's comment just a few minutes ago, to the evaluation of the injury to the head, that you had not evaluated the skull films for points of entrance or entry at the time of the autopsy or subsequently.
That's correct.
And that you were hesitant to give us an opinion as to entrance, and I'm also bringing up exit now, from your background, training, and expertise.
That's correct.
Continuing with the X-rays we haven't viewed yet, we have X-rays on the viewer now 7 and 9 by your notation, but not necessarily in order of having been taken. 9 is a chest X-ray. Was this taken with a portable X-ray?
Yes.
And that's prior to the autopsy. And 7 is lower chest and abdomen. Now, there are white spots present in the right lower part of number 7, left upper scapular area of number 9. Small, tiny spots. Would you have an opinion on what these are?
On film number 9, the chest X-ray, all of these irregular pinpoint opacities appear to be strictly film artifacts. They're brought about by dirt on the cassette and other things. On film number 7, the AP abdomen, these are similar artifacts. Unfortunately, relatively common with portable technique and dirty cassettes.
7 and 9. Do you recall, was any special care taken in taking the X-rays as far as artifacts, potential artifacts being caused by dirt?
The experienced radiologist can usually just read back very rapidly.
You're satisfied those
Yes,
are?
I'm satisfied. All on those two films, 7 and 9, all irregular pinpoint type densities seen are artifacts most likely due to very almost microscopic specks of dirt on the cassettes that held the emulsion film.
And as we look at each of these X-rays, implicit in your discussion of the X-rays is that these are the X-rays that you took at the time of the autopsy and that you later labeled and put into the archives.
Yes.
Have you seen anything that would suggest any alteration of the X-rays in any way, shape, or form as you have viewed them? Apart from the artifacts, the heat artifacts you had discussed on the skull X-ray.
No, apart from the heat artifact, no.
Yes, sir. Dr. Petty. Yes, certainly.
I've seen a lot of portable X-ray films exposed in the autopsy room, and not infrequently one protects the cassette by wrapping it or something. Were these cassettes so protected at the time they were placed under the body of the victim?
I really don't recollect. I know in the case of the skull X-rays, no, they were not protected. I certainly can't recollect any special precautions taken with the body cassettes. You must remember at that point we had not made the incisions. I think that's the primary purpose of doing that, is to avoid fluids and on getting onto the cassette.
The only reason I ask that is that I wondered in regard to the artifacts, if some of these might not have come from particles of metal or whatever on the plastic or sheets or whatever that the cassettes might have been wrapped in. That's the only reason.
It's a possibility. To the best of my knowledge, they were not protected in any special way. This becomes a different situation. The body has to be washed, or there are body fluids that might contaminate it. Then we would take steps to protect it.
Dr. Ebersole, I'd like to call your attention to one particular pattern of material which is, well, for the record, appears to be located over the second rib, and you'll note here that there is a triangular thing, and then there seems to be trailing off of three little things in that direction, as if, do you see that commonly as an artifact?
Let the record reflect Dr. Ebersole and Dr. Weston are discussing film number 9, chest X-ray.
I feel that this artifact, although it has a stellate irregular shape, is really no different from this type of thing seen here.
Well, the only difference is that they seem to be lined up, you see, as if there was something there and then something smudged.
These also appear to be lined up.
Mm-hmm.
But this is seen, yes, with artifacts.
It is.
Uh-huh.
You feel more comfortable about talking about artifactual material in an X-ray than you do about some of the other things. I mean, certainly you've seen many X-rays.
I feel these are really too bright. So then we ought to have other opinion on it. But it is a very typical dirt mark.
Okay. What about these?
These are
okay. Thanks.
I think it might be well for you to, as you look at these, to put up a film where we have a known metallic density, such as that birch shot or pellet.
Can we have some decorum, please? Off the record. Now, we'll proceed. We're almost finished with the x-rays. As we get to x-ray number 9, correction, x-ray number 8, is of the right upper chest and right upper extremity. Do you recall specifically taking this x-ray and anything you might comment about it?
Yeah, this is one of the x-rays taken.
There's a prominent radiolucency on the right side. Could this have been taken after the lung heart viscera had been removed? And do you remember taking x-rays of the chest after the viscera had been removed?
Labeled number 8. Normal lung markings, even normal post-mortem lung markings are not present, and we've seen no cardiac shadow. So I have to assume that these were taken after the viscera had been removed.
Do you have an independent recollection of correction? Is that what you meant when you referred to earlier repeating the x-rays?
Yes, I think these probably represent a second go-around. These are films 8 and 10 for the record. And my remarks on film number 8 also extend to film number 10. There are no post-mortem lung markings, and the cardiac shadow is absent. So I think it has to be assumed these were taken after the thoracic viscera had been removed.
As an interesting aside, that a question has been raised, on number 8, there is a normal hospital marking that you use to identify each x-ray. Is that correct? With the number on it, 21296 U.S. Naval Hospital.
Correct.
And that is present on all, is that the same label you used on all the x-rays?
Yes.
Yeah. That isn't present on number 10.
10. Unless you don't have a hot light.
No, but we inspect that too. It's not present.
It's not there.
Do you recall what might have happened? So,
the technician may have forgotten to affix the marker to the cassette. It may have been placed outside of the beam on the cassette so that it doesn't show.
But are you satisfied that this is indeed an x-ray that you took at the time you took, in the same time period you took the other x-rays?
Yes, sir. I am.
And the purposes you stated of taking these x-rays was entirely to make sure a bullet was not being overlooked?
That's correct.
On film number 8, in the topmost portion of the film, lateral to the lower cervical spine, are some radio-opaque material. Do you have an opinion as to what that material is? Or have you looked at, noticed, or considered that before?
Irregular.
This is my serve as a hot
Yeah, right. Almost immediately lateral to the right lateral mass of C7 is opacity that might represent metal. Far to the right of that, tiny pinpoint opacities are definitely artifacts. What I'm talking about here are these artifactual. This is the one that I'm describing. That may represent a metallic fragment.
Dr. Ebersole is referring to the larger medialmost radio opacity as being possibly a metallic fragment.
Here are artifacts again, but this may represent
whereas approximately
this one would have to be questioned also.
Approximately a centimeter lateral pinpoint dust-like dots being artifactual.
I just asked Dr. Ebersole, I think it's separate that from the bone fragment.
Dr. Coe.
I think it's somewhat difficult, but it appears to be more dense than the surrounding bone.
Yeah.
Yes.
Dr. Spitz.
Do you see a fracture in the area?
I suspect there may be a fracture of the lateral process there. I cannot say for sure on the basis of these x-rays.
Lateral process of what? Of which?
It would be C17-1 possibility. Here's the first rib swinging over.
Yeah.
C7.
I'd again like to, Dr. Weston speaking, I'd like to call your attention now to the configuration of this. This is the fragment you're referring to?
This is a fragment I would suspect might be metallic in nature.
Which did you say was an artifact?
I think here you can see some very clear-cut artifacts, these pinpoints.
Dust layer.
Yeah. Now, I'd like you to look at it with the hand lens. You see that... well, no, let me...
What I see, I don't know, maybe I'm seeing more than what's there, is something that looks like this.
Dr. Weston is now drawing on the blackboard and illustrating the...
I'm not sure of the exact
that's what we're talking about.
material.
That's what you're talking about?
Yeah.
Now, you notice how these line up with this defect here? Do you attach any significance to that?
Could Jim draw that on a sheet of paper?
I don't see the punctate things just as drawn are artifactual.
You think they're artifactual?
Yes, sir. Here, this area here is artifactual.
No. Put your hand lens on there and get up close to the little fragment. You'll see that closer to the fragment itself.
Okay, I got it.
There are two or three little things that line up with that thing there. Does that help you to determine one way or the other whether it isn't or is artifact?
I cannot say positively. The fragments you're talking about, these are 4 or 5 with punctate densities extending out lateral to the crescent-shaped fragment and in line. They might well be associated with it, but I can't say for sure.
Would they help you to reach a conclusion as to whether that was a metallic or a bone?
No, sir, they would not.
They wouldn't. Now, would you compare those, for just a moment, with the things that we referred to earlier
On X-ray number 7.
In which you again indicated at that time that they're artifacts. And
those I feel strongly and still feel are artifacts.
You do. Okay, thank you.
By shape.
Yes, Dr. Rose.
One of the questions from the X-rays, can you make an estimation as to whether the larynx and neck organs were present or were absent?
don't think conclusions could be drawn from these X-rays, Doctor. I see on X-ray number 10. No, I cannot be sure from these X-rays.
Thank you.
Do you have an independent recollection whether the neck organs were examined in the course of the autopsy, referring specifically to the trachea and blood vessels in that area and larynx?
No. My memory is very vivid for seeing a bruise in the right apex of the visceral pleura on the surface of the right lung, but I was not close enough or was away on one of these X-ray runs when that area was examined, the trachea specifically.
So when you say no, you don't. No means you do not have a recollection, or no, it was not done.
I do not have a recollection. My problem there, Doctor, if I back Dr. Rose's question, is that I don't see a tracheal air shadow, which I wouldn't expect to see since I don't see lungs either. I assume the viscera have been removed.
Excuse me for a moment. We'd like to go off the record so the tape can be changed.
Almost finished. Please take your jacket off if you'd like. When I met Dr. Ebersole, he had a turtleneck sweater on and hip boots. He was about to go skiing. Continuing our discussion with Dr. Ebersole, X-ray number 11 is of the lower chest and abdomen, also without an identifying marker in the film, but with a red metallic tape, identification number 11. Could you advise us as to whether or not you took that X-ray and whether that was taken at the first set of X-rays or after the autopsy was in process?
Once again, this X-ray number 11 shows a generous portion of the lower chest. I see no lung markings or cardiac shadow. So I assume that this X-ray had to have been taken after at least the initial portion of the autopsy with the thoracic viscera removed. As far as abdominal contents here, I cannot absolutely positively identify renal shadows or bowel gas. So this may have been after this has been removed. Although I do think we see some bowel gas here. I guess questionable as to the status about the subdiaphragmatic content. Certainly, this has been after the thoracic contents have been removed.
Do you see a liver shadow?
I can't see a liver shadow on here. No, I can't definitely see a renal or kidney shadow on this. Psoas shadow is present on the right, to some extent on the left.
So you would conclude from that both the liver and the kidney had been removed at the time of that?
On the basis of this film, yes, sir. I couldn't identify it.
Thank you.
Do you notice there's some increased calcification of the lower costal cartilages? Is that more than you would expect for a young man of this age?
No conclusion should be drawn from calcifications of the costocondyle junction, to my knowledge.
Do you have an independent recollection of looking at the kidneys?
No.
At the autopsy table?
No, sir, not myself. I saw across the room the kidneys being weighed.
You saw the kidney. Do you have an independent recollection of seeing the liver, heart, lungs being examined outside the body?
I do definitely remember the liver being weighed outside the body and the kidneys. The reason for that, if I may explain, I think we're all somewhat interested in his adrenal status. And from standing across the room, I believe in conversation with Dr. Fank, as that was the point at which these organs were weighed. To the best of my recollection, Dr. Boswell actually weighed these organs.
Did you notice on the initial x-rays of the abdomen, such as number 7, where the viscera appear to be present? Is this an x-ray taken prior to
I believe that
evisceration?
was taken before the incision was made.
Did you look for any abnormalities of the adrenal glands, such as calcification?
I'm not expecting to be visible on plain x-ray.
Well, if there were calcification of the adrenal glands.
Calcification, yes, but I did not look for them that night. Once again, we were looking for a bullet.
But relative to the point of the adrenal glands, there was some concern at the time of the autopsy about the status of the adrenal glands?
No, sir, I didn't say that.
I
said as a result of newspaper articles, et cetera, and the media, we were all had heard that he may have had adrenal insufficiency. But certainly this was not discussed, or to my knowledge, even mentioned the night of the autopsy. It was in that background that I happen to remember specifically seeing the way the viscera, because the thought went through my mind, with all we've been hearing about his adrenals, I wonder what they'll find.
Well, some question has been raised relative to the autopsy personnel being aware of and perhaps concerned about the wishes of the family as to rapidity in which the autopsy would be done and as to the extent of the autopsy. Was that an impression you had at the time of the autopsy, that there was any such consideration?
I had no contact with the family, nor did I mention the family. Did I hear the family mentioned that night?
So as far as when you say, well, more specifically, do you think in any way, shape, or form there was any specific consideration given to the wishes of the family in any manner in which the autopsy was conducted, both as to extent and as to rapidity of being performed?
I'm aware of no such strictures on the autopsy protocol.
I'd like to be more specific. Did the President's personal physician actually indicate any instructions to either Dr. Hume?
Not that I heard, no.
And you were there about 80 to 90% of the time, would you say? You never heard him say that you ought to do this or you ought not to do that?
No, sir.
You didn't?
No.
Jim, are you referring to Admiral Berkeley? I just want to...
Do you have a specific recollection of Admiral Berkeley being there? Do you know who Admiral Berkeley is?
Yes, I know Admiral Berkeley. I have to admit, at this point, I don't recall his presence.
I'm sorry, Dr. Webb.
No, I was just going to add, I think Dr. Ebersole's answer makes it clear, but I just wanted to complete it as a corollary to Jim's question. Dr. Ebersole, you don't recall then, I assume from what you've already said, having heard any other admiral or general or Secret Service or FBI agent say to any of the 3 autopsy physicians or to anybody else in the autopsy room that because of request or instructions from the family or from anybody else that any particular procedure will or will not be done, or that the autopsy will in any way be limited. Is that what you said?
That is correct. I was not aware of any limitations as to what we could do there.
How many people were in the autopsy?
We have to utilize a 15-year-old memory now.
Well, yeah, but you know whether there were 5 or 10.
I have spoken to 15. Depending on what time you were there. There was milling back and forth, Doctor, and as I have said to Mike on occasion, if we all had a chance to rehearse this, I'm sure we would have done it differently. But there were White House staff. I remember an Air Force Brigadier General there. There were men that we assumed to be Secret Service agents. And depending on which slice of time you want to take, there may have been 6 people there, or there may have been 11 or 12.
Now, relative to the other discussion about perceived pressures by the
potential perceived pressures by the prosectors. We've all here been in the position in doing official autopsies where, for one reason or another, we are aware of desires by family members, A, not to do an autopsy, or to do it rapidly, or to do it partially, and we've all been in that position as forensic pathologists. Often this kind of awareness can't be pinpointed to one person telling another person, but just a general behavior pattern, general ambience. Apart from did anybody say anything to anybody, is it your impression as a physician who was there, your role being different than Dr. Yoon's and Dr. Boswell, or Dr. Fink, that there was a perception, for whatever the reason, real or imaginary, on the part of anybody doing the autopsy, especially what you raised about the adrenal glands in particular, and other considerations about rapidity in which the examination will be done that haven't been raised here, that there was any feeling from your impression on any of you four doctors' parts that any part of the body shouldn't be examined, or it should be done quickly, or it should be limited in any way, shape, or form.
I was not then aware of any such pressures. I'm aware that they can occur in the course of an autopsy.
To the best of your recollection?
To the best of my recollection, there was no such pressure on us. I felt a little bit of personal pressure when the first X-rays did not show a bullet, and I was asked by the Secret Service agent to repeat. But a little bit of pressure, certainly nothing overwhelming. I knew what he was after, but I didn't feel myself that repeating the X-rays would show the bullet, but we did it.
Now, you repeated the X-rays specifically because what you were after was to find the bullet. Because there was an entrance in the back and no exit.
And at least no exit we could identify.
Apparent. Okay.
Before you leave that, can I ask
Sure.
one more question? I'm not clear of the chronology. When you first started talking, you gave the impression that everybody had the impression that there was a bullet hole in the back of the neck fairly early in the inspection. In other words, you gave me the impression they rolled the body over almost immediately. Is that a correct impression?
I don't know if we look at the anterior or posterior aspect first. I suspect it's posterior.
They looked at the posterior.
Gaping head wound and a wound of entrance.
They saw the wound of entrance on the back of the neck almost immediately.
I believe so, yes. Now, this, again, is a question of recollection as to whether we look at the anterior or posterior surface first.
Yes, but you said that they didn't recognize this as being an exit wound until after the conversation with Dallas, which was 10 or 10:30.
Or later.
By that time, you had already taken 2 steps.
No.
Oh.
When both aspects of the body had been viewed, and I do not know in what order they were viewed, we were faced with the problem of a wound of entrance. And no known wound of exit. So at that point, and we perhaps would never have taken any X-rays had we had a wound of entrance and a wound of exit. Remember, I'm standing by waiting for the prosector to start with my X-ray equipment. We certainly had not, at least to my knowledge, had we planned to take any X-rays at this autopsy. But when it became apparent we had a wound of entrance and no known wound of exit, this is when I was brought into the action.
When I chronologically, though, relative to when the body was first undressed and inspected?
My recollection was that we took most of these pictures before the autopsy got started, but obviously the films show that my recollection is not very good in that respect. Okay. And I would have to state that there must have been quite a time gap between the first films and the later ones that show that this were removed.
3 later ones. There were 3 later ones. Do you have any impression or recollections at the initial decision-making process of what to do prior to you being asked to take the X-ray? If there were
an exit perforation apparent as to whether or not you would have taken any X-rays?
I don't know.
You may not have.
We may not have.
Do you have any impression as to whether or not this would have influenced the extent that the autopsy would have been done? The extent of the autopsy?
I know.
Was there discussion, perhaps, or any impression that if there were an obvious wound of exit, that perhaps an autopsy would not be necessary?
No, sir, that was not mentioned.
Your impression?
My impression is had we had a wound of exit, we would have proceeded with an autopsy in the usual fashion, and I would have stayed in my corner all night.
Now, to finish up, the last of the X-rays that we haven't seen is number 12 of the lower thigh and upper tibia and fibula bilaterally.
Distal 2/3 and upper third, maybe.
Do you recall as to whether or not any X-rays further distal of the lower extremities were taken?
I do not believe we took any further. I would like to call your attention on this to several artifacts. Those of you who have been asking about this, here are some nice punctate ones. Here's an irregular one.
Dr. Ebersole is pointing to the medial aspect of the left thigh, where there are a series of 3 prominent radiolucencies, which he's referring to as artifacts.
Probably here a pressure mark on a piece of lint on this set. Pieces of dirt, irregular. Here's some artifacts.
Did I say lucencies? Radiopacities. If I may tax your patience, Dr. Ebersole, we've now reviewed all of the X-rays that we have, and these are all, to your knowledge, that were taken. You've stated.
There was some 14
different X-rays, 3 of bone fragments. Specifically, you mentioned Dr. Morgan earlier, and who had looked at the X-rays from the Clark panel.
Mm-hmm.
Excuse me.
Dr. Ebersole, when Dr. Morgan made that comment, sorry to interrupt you, Michael, did you at that time know that he had reviewed these films in 1968?
No, sir. No, sir. I asked specifically that the films be reviewed, but I don't know who reviewed them. The Dr. Morgan statement was, I became aware of a statement made in Denver as a result of a newspaper article being forwarded from me by Dr. Richard King.
Oh, you weren't there.
I was not there. I still have a newspaper article in my possession where the statement, at least made in that media, was that a radiologist was not present during the Kennedy autopsy.
Oh, Dr. Hayden,
yes, sir.
may I also ask you?
Dr. Petty, yes.
I'm with Dr. Weston here, and I'm trying to get some sequential arrangement to this. And perhaps this is unnecessary, but when the bullet wound of entrance was seen on the back or the neck, wherever it is, then it was decided in the absence of a bullet wound of exit that some X-rays were necessary to locate any missiles. These were taken, and I assume viewed by those who were actually carrying out the autopsy. Then, as I understand it, there's a quandary, where was the bullet? And somebody suggested taking a second set of X-rays.
Yes, that suggestion came from a non-medical person, a Secret Service agent.
All right, so a second set of X-rays was taken, and you say, Mike, there are 3 of these that were taken later?
Yes, we have 3, I believe 8. I'll name them for you specifically, showing the body partially eviscerated.
All right. Did anybody suggest to you or ask you to X-ray the viscera that was removed between the first set of X-rays and the second?
No, sir.
Excuse me, at this time I'd like to switch the tape over. The tape is now working again.
You want him to repeat what you just said?
Yes, if you could, please.
The taking of the X-rays again were stopped to the best of my remembrance. Once we had communication with Dallas, and Dr. Humes had determined that there was a wound of exit in the lower neck anteriorly at the time that the president arrived at the hospital in Dallas. I think once that fact had been established, that my part in the proceedings were finished.
May I ask two questions further? One, did you see the wound in the neck and associate it with a bullet wound of exit after it had been pointed out that the tracheostomy had been through that area?
No, sir, I can't say that I did. I saw, after the dissection had started, I saw the area that Dr. Humes was very interested in. He pointed out to us that this was a tract running over the apex of the lung. I think he used the term bruising the apex of the lung and pointing toward the midline. I remember the area was open and he was pointing this out to us. I can't recollect if I saw this area again after that information was known to him.
All right. The second question that I have is, you said that you left the autopsy area somewhere around 3 o'clock in the morning. What was the condition of the body when you left? Was the head reconstructed or wasn't it?
I can't recollect the condition at that point.
I asked a question in response to Dr. Petty's
Dr. Locum.
In response to Dr. Petty's question, you said the area was laid open. Now, do you mean that they ran an incision from the point of entrance across the shoulder to demonstrate looking down in a superior fashion into the apex of the lung, or are you really meaning that the lung was taken out and you were looking into the apex?
Again, I have to rely on a 53-year-old memory and a 15-year-old event. But as I remember, I was looking from the anterior aspect into the chest after the viscera had been removed and a probe had been passed from the wound of entrance, and one could see the bruising of the parietal pleura at that point. From below and front. From below and front, looking up.
Dr. Ebersole, hypothesize with me for a moment, please, that if on the autopsy evening, Dr. Humes or any of the other physicians or people present had not received information at that time that there had been a bullet entrance wound in the front of the neck, that no such information was known by anybody on that evening. What would be your professional opinion as a radiologist, what would it have been at that time concerning the need or desirability for taking additional X-ray pictures?
No, I think we would have had to. I'd like to try to keep retrospective thinking out of this, but it's difficult. I think had we not had that information eventually, I would have wanted to take the body to the main X-ray department and do an honest-to-God total body radiograph. As I suppose it's remotely possible that a bullet entering the back can end up in the ankle, but again, in your hypothetical case, I think this is what we would have done.
Whose decision was it to take portable X-rays rather than have the body initially brought to the main X-ray room?
I think it was probably a joint decision between myself and Dr. Humes.
Did you consider bringing the body first?
I did not.
Had you taken X-rays in the autopsy room before?
I have not, no.
Okay.
I had X-ray bodies in the department, I might say.
In the department, but not in the...
But not in the autopsy.
What kind of X-ray, portable X-ray did you have? The one that's usually used for live patients?
Yeah, knowing the equipment we had at Bethesda at that time, it was either a Picker or a General Electric portable machine. And of 1963 vintage, we have much to be desired in terms of X-ray detail.
Again, not to belabor the point, did you in any way feel it would be inappropriate to ask to have the president's body wheeled down to the X-ray room, or was that not really part of your thinking?
That wasn't really part of my thinking.
When you left at 3 in the morning, do you remember Dr. Humes, Dr. Boswell was still there?
They were still there, yes.
And you remember what they were doing?
I believe this was closure. I asked Dr. Humes if it was all right for me to leave.
Were they closing, or normally, was he a funeral director there?
Not to my knowledge.
Yes, Dr. Weston.
I just want to clarify the record. I appreciate that, it's been many years. But my understanding of the sequence of events was somewhat different than what you said, and I want to refresh your memory and ask you if it's possible that this version is as consistent as the version that you gave. And I'm reading now from Special Agents Siebert and O'Neill's report, which seems to me to be the most accurate record of what actually transpired, because they have times in it from time to time. And on the third page of the report, they say specifically that following the removal of the wrapping, it was ascertained that the President's clothing had been removed. It was also apparent that a tracheotomy had been performed, as well as surgery of the head area, namely in the top of the skull. All personnel, with the exception of medical officers needed in the taking of photographs and x-rays, were requested to leave the autopsy room and remain in an adjacent room. The implication is, then he goes on to say, upon completion of x-rays and photographs, it was my understanding that from the very beginning it was their intention to take a certain number of x-rays, at least of the head and the neck and the chest, which probably represent the first series. And then he goes on to say, x-rays of the brain area, which were developed and returned to the autopsy room, disclosed the path of the missile which appeared to enter the back of the skull, and the path of the disintegrated fragments could be observed along the right side of the skull. The largest fragment. All the description then has to do with the examination of the skull. Now then, he goes on to say, during the latter stages of this autopsy, Dr. Humes located an opening which appeared to be a bullet hole, which was below the shoulders and 2 inches to the right of the middle line of the spinal column. This opening was probed by Dr. Humes with a finger, at which time it was determined that the trajectory of the missile entering at this point had entered at a downward position of 45 to 60 degrees. Further probing determined that the distance traveled by this missile was a short distance, inasmuch as the end of the opening could be felt with a finger. Inasmuch as no complete bullet of any size could be located in the brain area, likewise no bullet could be located in the back or any other area of the body as determined by total body x-rays, an inspection revealing there was no point of exit. The individuals performing the autopsy were at a loss to explain why they could find no bullets. And it was subsequent to that time that I believe you took the post-evisceration autopsies. Now, is that
reasonable to you that a pathologist would carry out an autopsy without looking at this nature, without looking at both the front and the back of the body?
I'm not questioning what
my remembrance is that we were aware of the wound of entrance relatively early in the game.
Well, that's what he says there, and that Dr. Humes probed it.
No,
he didn't say that.
That's not what they say. So the latter stages of the procedure. I'm sorry. As a matter of fact, there's another record somewhere that indicates that it was about the time they were ready to sew the body up. That they were washing it, and they then discovered the wound.
No, sir. I would have to take a.
That isn't your recollection.
No, that is not my recollection.
Did we specifically ask I thought he had early on. I thought he said.
What did you say? Did you found what early on?
The wound in the back.
In the back?
Yeah.
In the back?
Yeah.
I'm sorry. I thought you were asking about the wound in front.
No, the wound in the back. Another point that comes up relative to your testimony is there was some mention, as Dr. Weston says, of the bullet being probed with a finger. Do you remember that specifically?
No,
or do you remember being probed and looked at in any way, shape, or form?
Yes.
Do you remember some tentative discussion as to whether the bullet entered and then dropped out?
Yes. Is it a discussion of that type?
Is it your impression at one time in the course of the X-ray and after the X-rays were taken that this was considered as a possibility?
Yes.
Is it your impression, perhaps, and again, as Dr. Wett said, 15-year-old memories get clouded. If we assume that the information about the tracheostomy through a bullet hole was not available to the doctors that evening, but came later on, could there have been a tentative conclusion reached, or was there a tentative conclusion reached that evening, that in fact the bullet entering the back region had dropped out, and that's why it wasn't present, and that explained the autopsy and X-ray findings?
I don't remember such conclusion being reached, but assuming it, I suppose it could have.
This is Petty again. May I make a comment, please, in regard to the statement of the agent, Secret Service agent, FBI agent? Which one?
They're FBI agents, Francis O'Neill and James W.
Which one did you just read?
They're both in the same report.
I see. Well, there's an inconsistency in this because they state right off that everybody was requested to leave at the time the photographs and the X-rays were taken, and yet the photographs that we have show very clearly a wound in the upper right back, if that's the way to refer to it. And if that wasn't discovered until very late in the autopsy procedure, there must have been a second exposure of film somewhere so as to illustrate that.
Well, I'm sure that photographs were not taken all at the same time. There's no question about that. Because some of the photographs were taken after the organs were removed. Some of them were taken after the skin had been turned back on the skull.
That's perfectly true, but this rendition bothers me.
Well, there's certain things we'll have to discuss.
May I make a comment?
But we'd like to get Dr. Ebersole's opinions on these before.
That's all I was concerned.
I certainly feel we were aware of the wound, the back wound, if you want to call it that, very early in the autopsy.
That's what he said when you first started.
Yeah, I know, that's what I'm trying to say. But
He was looking in the front and looking in the back. When you first started to today, he said that.
That's Dr. Spitz.
And this one, where I was just, I knew it was at odds with this report. I wanted to ask him whether it's possible that his recollection was.
But one of the factors that would be of some interest to us is that your X-ray taking may have been related to an initial concern that had been expressed, and that you remember being expressed, of the back bullet entering and then dropping out in Dallas. Correct?
No.
Oh, I'm sorry. Yes, I'm sorry.
My initial impression is that we have a wound of entrance, and we do not have a wound of exit. And I don't remember any conversation about a bullet dropping out.
Oh, I'm sorry. Could you indicate?
I don't remember any conversation.
Do you remember a conversation when this back wound was probed that it appeared to end?
No.
In the back?
I don't remember any conversation.
Dr. Ebersole, I just want to thank you very much for exhibiting great patience with all sorts of people. I, for one, am through with any questions.
Just the last thing I want to ask you, relative to the X-rays, the radiological interpretation by Dr. Morgan. And have you had occasion to read the Clark Commission findings? The entrance bullet wound was placed in the Clark Commission report, which is public record, at 10 centimeters above the external occipital protuberance, which would be about here on X-ray number 2. In viewing these X-rays at this time, would you have an opinion as to the X-ray
impression relative to what you recall when you were there at the time?
I think that's very consistent with the X-rays and what I remember grossly in the.
You remember grossly that this X-ray interpretation is consistent with what you saw at the time.
Dr. Bodden, would you please articulate where you're pointing to on the skull?
I am pointing to a point 10 centimeters above the external occipital protuberance on X-ray number 2. Now, here on film number 42, taken color photograph 42, taken at the time of the autopsy, initial JB on the back, is of the back of the skull. Do you remember or have any independent recollection of that condition of the president when you were in the autopsy room?
Visual recollection is more of a gaping occipital wound on this, but I certainly can't say that this wasn't the way it was. Again, we're relying on a 15-year-old recollection. But had you asked me, without seeing these or seeing the pictures, I would have put the gaping wound is here rather than up more forward.
Well, there is, just to refresh your recollection, in photograph number 32, another view superiorly,
right,
and that's more of your recollection of how the head looked.
More of my recollection, yes. This is more of a recollection.
When you compare those two photographs, what inference do you draw now about the nature of the wound, nature of the gaping wound to the president's head in terms of where it was located? Earlier you said it was in the back of the head. Looking at these two views, how would you characterize the location of that gaping wound?
More lateral. That's more lateral and superior than the wound.
Did you have the opportunity to see the head in the view as evidenced by color photograph number 42, showing the back of the head?
No, I would have been more familiar with this aspect in positioning the head for the X-rays. I mean, this requires a forward effort to show this portion of the head on the part of the prosector, right?
Did you have the opportunity? You stated you had a better opportunity to see the view of number 32. Did you have the opportunity to see the view of number 42, showing the back of the head?
Well, assuming that was done while I was there, yes, I had the opportunity.
Is there a point in that photograph on the head which you take to be a bullet wound?
Sorry.
On number 42.
42? No, I
One other question I have has to do with the nature of the information you received from other sources on the night of the autopsy. You mentioned a phone call which helped clear up confusion.
Somewhere in the course of the evening, Dr. Humes received information from Dallas Ray, the procedures that had been carried out there. And number one. Number two, somewhere in the course of the evening, Dallas sent to us the bony fragments you saw, which were X-rayed. As to how this was carried out, the mechanics, I don't know. Somewhere in the course of the autopsy, Dr. Humes was made aware of the surgical procedures at Dallas, vis-a-vis the neck.
And what was that information?
Information: there had been a wound of exit there, a tracheostomy done, and a suturing.
Do you recall how that information was conveyed?
I don't.
Is there, Dr. Ebersole, anything that we discussed, said, that you feel needs any clarification, or anything additional you'd like to add, any additional photographs you'd like to see, so that the purpose being with the medical panel getting the most of the information you can offer relative to the medical aspects of the death of Kennedy?
No, except considering your recommendations that you have a team of forensic pathologists available when this should happen next time, God help us.
Dr. Ebersole, if I may ask I don't know, it's not a personal question, I think it's relevant. And I'll tell you how I know a couple of people, news media people, called me in my own community. There's some news release that came over, some comments that you made. I'm not suggesting for one moment that you can't express your opinions anywhere, anytime. That's entirely your right. I was just curious as to how came by, 2-3 days ago, that the comments had been made at that time concerning your forthcoming testimony.
A local reporter, Lancaster reporter, contacted me on an interview. Is it true that you're going to Washington? Yes, came out. And by and large, the questions asked were good ones, except the story that I saw and have heard about carried such things as Brake's 15-year vow of silence. Dr. Weck, I am half Irish. I can't hold my mouth shut for 15 minutes, let alone 15 years. I consider it was gross distortion in the stories. I did say, and I'm sure you've read this, that I did not feel that my x-rays would change the basic findings of one film.
No, I wasn't commenting at all on what you said. I was just curious, frankly, as to how
I was very angry at the
reporter, local reporter, just
silence, secrecy. This
was one of your local newspaper people.
Yes, this is the origin of it.
I'd like to just note to the record that Dr. Joseph Davis, Chief Medical Examiner of Dade County in Florida, entered the proceedings at near the end of the interview with Dr. Ebersole. Any other questions, comments?
I'd like to make one question relative here. You don't consider yourself to be an expert with respect to the interpretation of photographs taken at an autopsy?
No, sir.
Or in any sense, the jury would not want us to feel that we should consider any opinions that you've got other than your recollections of what you said. Is that correct?
As a matter of fact, Doctor, if I may enlarge on this, I was contacted by someone from this group several months ago, and I indicated I was not willing to cooperate as far as coming down here, but I would be glad to give a deposition in Lancaster, because I felt I had little or nothing to add to what has already been known. However, I met Doctor a few months ago. He pointed out to me what to me was a very disconcerting thing, that there had been some speculation about pencil lines drawn on x-rays. I realized that those were the lines that I drew at the White House Annex. And I think that, more than any other reason, made me want to come here to clarify for you that those were not any attempts by any ballistics expert to show passive bullets. I don't know what happened to those measurements, whether they were used by the sculptor or not. But that is how, in fact, I got on that lateral skull tunnel.
I'd like to thank Dr. Ebersole for all of us here for coming up and for your patience and forthrightness in responding to our concerns and questions, and for the aid you've given us in this panel in the evaluation of the medical aspects of President Kennedy's death.
Thank you.
I'd like to make one additional comment before anyone begins other discussions. This taping is concluded at 12:07. It began at 10:19 a.m. on March 11th, 1978. The place is room 503 of the National Archives, Washington, D.C. Staff members present were Donald A. Purdy, Jr., Staff Counsel T. Mark Flanagan, Jr., staff researcher. Our medical panel of consultants were also present. National Archives personnel present were Marion Johnson, Mike Leahy. One of the photographic panelists present to the committee, Tom Cannon. We also had a court reporter present. This concludes taping.
What would people like to drink with their sandwiches?